Hello, I'm Dr. Pooja Shenoy, a certified birth doula at Fernandez Hospital. Today, let's discuss about breastfeeding essentials. First and foremost, it's important for the woman to start breastfeeding within the first 1 hour after birth. This is what we call as the golden hour of birth. And no prelacteal feeds should be given to the baby, which includes no gripe water, honey, formula feeds, animal milk or jaram gutti. Exclusive breastfeeding should be followed from birth till the completion of 6 months. And introduce appropriate complementary feeds only after the completion of 6 months. It's also important to sustain breastfeeding for a period of 2 years and beyond if possible. This is the WHO recommendation. But having said this, it is also important to respect the woman's choice whether she wants to breastfeed her baby or not, as well as till when would she want to breastfeed her baby. We will now be going on to discussing the following: how breastfeeding works, hormones and milk production, breast milk and its constituents, breastfeeding the right way, and breastfeeding and the birth doula's role. Let's begin with how breastfeeding works. When the baby is put to the mother's breast, as the baby is suckling, the signals reach the mother's brain and 2 hormones are released. One is the prolactin and the second is the oxytocin. These hormones help milk to be formed in the small glands present in the woman's breast tissue. Through these glands arise small tubules which carry the milk into larger sacs behind the areola. And as the baby is suckling at the mother's breast, the milk empties into the baby's mouth. Next, let's discuss about hormones and milk production. The process of lactation happens with 2 hormones, prolactin and oxytocin, that is secreted from the anterior pituitary and the posterior pituitary glands respectively. The secretion of these hormones depends on 2 important factors. First is the suckling of the baby at the breast, and the second is the woman's emotional status. Let's now go on to discussing the factors that help and hinder the oxytocin reflex, which is responsible for the milk production. The factors that help this reflex is when the woman is thinking lovingly of her baby, when she hears the sound of her baby or the sight of her baby, when she touches her baby, and when she has the confidence and the trust in her own body to produce adequate milk for the baby. And the factors that hinder this reflex is when she is worried or anxious, stressed, in pain after birth, or if she doubts her own milk supply. Let's now go on to discussing the factors that help and hinder the prolactin reflex, which is responsible for the milk secretion. The factors that enhance this reflex is emptying of the breasts, suckling, expression of milk, and night feeds. And the factors that hinder the prolactin reflex is bottle feeding, incorrect positioning or latch of the baby, and painful breast conditions like engorgement or improper latch. Now, let's discuss breast milk and its constituents. The first is colostrum. This is produced during the first few days after birth. It is thick, sticky, and clear to yellowish in color. It is produced in small quantities, ideally around 30 to 90 ml. It is easily digestible and contains large quantities of antibodies, anti-infective factors, and growth factors. It also contains more protein, vitamin A, vitamin K than the mature milk. The colostrum has a gut clearing effect and it prevents jaundice by clearing the bilirubin from the baby's gut. The next is foremilk. This is produced early in a feed and it contains more water, lactose, and protein. This is responsible for quenching the baby's thirst. And the next is the hind milk. This is produced later in a feed and it contains more fat. This satisfies the baby's hunger and helps the baby gain weight. Now let's go on to discussing breastfeeding the right way. Let's now go on to discussing a good position for the mother. The mother should be comfortable with her back and her feet supported. The baby should be brought to the breast and not the breast to the baby. And the good positioning for the baby is, the baby's face should face the breast tummy to tummy. That is, the mother's tummy and the baby's tummy should be touching each other. The baby's neck should be straight with the ear, shoulder and hip in a straight line. And the whole body of the baby should be supported. This is important because if the baby is positioned well, it will lead to a good latch. Poor positioning of the baby is when the baby's head is turned to one side and the baby's ear, shoulder and hip are not in a straight line, nor are the baby and mama tummy to tummy. This is again important because if the baby is positioned improperly, this will definitely lead to a poor latch. Now let's go on to discussing a good latch or an attachment. This is achieved when the baby's mouth is wide open, the lower lip is turned outwards, the chin of the baby is touching the mother's breast, and more of the areola is visible above than below the mouth of the baby. If you can see these images, all the 4 points that we have discussed are met. So this is a good latch or an attachment. Poor latch or attachment. The baby's mouth looks closed. The lower lip is pointed forwards. The chin is separated from the breast and more areola is visible below the mouth and the lower lip. So you can see in these images, it is a poor latch or a poor attachment. Suckling. To ensure that the baby is suckling well, there are 4 points to keep in mind. First, there should be fullness of the cheek, an audible gulp, dropping of the baby's jaw, and the nature of the suckles is slow, deep suckles. Now, let's go on to discussing different positions of breastfeeding. We have the cradle position, the cross cradle position, the football position, the laid back position, and the sideline position. Let's begin with the cradle position. In this position, the mother cradles the baby's head in the bend of her arm, and rest of the hand supports the baby's bottom. The baby is supported with the arm on the same side as the breast she is feeding from. The next is the cross cradle position. In this position, the baby is brought against the front of the mother's body. The baby is held in the bend of the arm opposite to the breast the mother is feeding from. That is, left arm for the right breast and right arm for the left breast. And this is a good position for small and sick babies. The third position is the football position. In this position, the baby is tucked under the mother's arm, off to the side and held with one arm. This is helpful for mothers with large breasts, mothers having twin babies, after a cesarean section, and for babies having difficulties attaching deeply. The fourth position is the laid back feeding. In this position, the mother reclines back about 45 degrees and the baby lies face down on top of the mother's breast with his arms hugging the breast on both sides. This position is easy for the baby to attach deeply, particularly during early days and weeks or if the mother is having severe back pain. And the last position is the sideline position. In this position, the mother lays down on her side with the baby facing her. This is a good position for night feeding, after a cesarean birth, or mothers with hemorrhoids or pain due to perineal sutures. Let's now go on to discussing breastfeeding and the birth doula's role. Before the baby is born, it is important for us as doulas to encourage the couple to attend a breastfeeding class as well as provide breastfeeding education. We can provide local references of lactation counselors, as well as share resources on breastfeeding. Immediately after the baby is born, as doulas, we can help with initiating skin to skin and the first breastfeed. We can also help with achieving a breast crawl if the mother wishes. Thank you.